Hi, everybody. I'm John Hammerly with Room Now. I'm joined by with Dr. Vibeke Strand from the West Coast, where she tells me it's still warm. What's the temperature out there, Dr. Strand?
I think we were up to 79 today. It
Oh,
was very
nice.
nice, but I was inside.
I understand. Attending sessions.
Right.
What was the highlight of today's sessions for you?
I think they did a good opening plenary. And that, of course, included a very nice talk by the editor of New England Journal of Medicine about COVID and about developing a vaccine and vaccines in general. Very enlightening. And then we had the year in review by Dr. Yazdani for clinical, and then Dr. Bucala for research, and those were both excellent.
We talked a little off camera about the advantages and disadvantages of this virtual session. What have you, in the very short time on this first day, seen as far as what glitches may have happened?
Well, I think it's a very in-depth platform, and they're servicing people from all over the world. We could see in the chat where people were coming from, but they were all saying they were getting good service, and they were quite impressed. And I had some minor times when it stopped, but it would come back on. So I think altogether, it's really good. It's even better than EULAR was when they, of course, didn't have as much time to get all set up after COVID started. But they've also made everything downloadable. You can get the slides and all of that and you can go back and listen to it once it's recorded up until March 11th. So that's a pretty good advertisement.
Biggest disadvantage of this virtual non-contact meeting?
We don't get to see each other, but I was just at an RRF meeting where we were going between breakouts so we could all talk among ourselves as a small group, and that was very nice.
And how about advantages?
No travel. I think that's the biggest thing. It's been really nice. I've been doing a lot of lectures, essentially all over the world. Thank God I haven't had to fly at all. It's so nice not to be on a plane for long periods of time. And also, people are not so tired when they're at a Zoom meeting because they haven't had to get up early, stay up late, then get up before their usual time zone to be scintillating and thoughtful. And so I generally think if you haven't done too many Zoom meetings in one day, which can be really tough, you get a lot more participation.
Do you think that this format has changed the face of ACR forever?
Well, I'm wondering if it can't be used, at least to some extent, so that we can all, so shall we say, archive, go back and look at presentations, whereas before we would see them briefly for 10 minutes and they were gone. And you might be able to see the abstract. I think if they're going to be able to make this all virtually then and hold it out till March, the same kind of thing can be done even when we go back to live meetings. And maybe then you can make the choice, depending on how far you have to travel, whether you're going to travel or whether you're going to be virtual.
And maybe there's some type of hybrid involved?
Yeah, that's what I think they're thinking. So I think it'd be a good idea.
I know that I was talking to Dr. Birnbaum just a few minutes ago, and he was a little anxious and looking forward to seeing what it's like to visit some poster sessions. Certainly much different than seeing them in a poster hall with thousands upon thousands end to end.
Yeah, but the nice thing with this is that we've all recorded 3 minutes of what our poster's about. So you could be looking at the poster while you're listening to it, and you can download the PDF of the poster so you can come back to it and look at it again. And I guess you can go back and listen to the recording anytime you want up till March. So in a sense, you get more exposure to the poster, but you miss seeing everybody that you like to talk to.
Do you know whether or not you'll have any time to have live discussions with people visiting the posters or vice versa?
I don't really know. I think there may be something during the poster sessions, but also there's all these times in the middle of the meeting when people can get together informally.
Mhm.
So that should work, kind of like what we just did in the RRF get together.
Mhm.
But I think it really depends on how much people want to try and do that.
Any sort of guidelines that will be released that you're looking forward to reviewing?
Yeah, there's going to be new guidelines for the treatment of RA on Monday. I think it's Monday. We'll just check. Yeah, Monday. So that'll be relevant to the debate, what they're going to say about when we can use or when we should use or when we should think about using an oral versus a biologic. So I think that's important. And I have one point about the debate that I will share with you, and that is that
Okay. I promised I wasn't going to ask any questions.
Yeah, I know you did. Thank you. We have 22 years of use of the TNF inhibitors, so we really know their safety. We really only had the JAK inhibitors for just about little over 7 years, just about 8. And so it's really kind of hard to say that when you know the depth of a class for which you have 5 members and have treating many different diseases, I think now we're seeing as an oral set of therapies that are very similar to each other also, but are probably going to treat a lot more different diseases than just rheumatologic. So they're probably going to have much broader applications.
Well, I appreciate the little peek into the great debate.
Yes.
I promise I won't ask any other questions. I want to stay on your good side. Dr. Strand,
that's fine.
Thank you very much for your time today. I'm looking forward to maybe doing another interview with you along the way, and we'll see you somewhere along this virtual highway called ACR 2020.
Great. Thank you.
Thank you very much.